Hi, I'm Joanna Strecker, and for my debate, I did opioid drug misuse in young adults and why there needs to be an increase of awareness. This falls under three dimensions of health: physical, because it affects the chemical reactions of our body; mental, because it affects our thoughts; and social, because it affects the interactions with others. Just a heads up, I am currently at a drugstore where I work at the pharmacy. So if you hear people talking in the background, I apologize because I work from 12 to 9 and I get limited time on homework between track, work, and school. So, let me begin. Many Americans are not aware of the threat that is lying directly under their noses. 1 in 3 college students have used stimulants that are not prescribed to them. An example of this is Vyvanse, cocaine, or Adderall. Opioids are now one of the leading causes of death of Americans under the age of 50. This is alongside heart problems and cancer. The types of drugs that are misused mostly contain opium or opium-like properties. Adderall is prescribed to assist with ADHD in young children. Without proper regulation, there can be a dependence developed. The prescriptions for this drug have increased drastically over the past decade. It can be prescribed from 10 milligrams to 30 milligrams. Hydrocodone is the most prescribed drug, even with harmful side effects. It can cause trouble with breathing in young children. Despite it being very addictive, doctors still prescribe the painkiller. Codeine is another weaker opioid, but it can still cause issues because it can be obtained without a prescription. All you have to do is show a driver's license at the pharmacy that I work at, and you can obtain cough syrup or pain-reducing pills. There are many reasons why middle-aged people are turning to drugs. Stress is a big factor as to why some rely heavily on the drugs. Hundreds of thousands of young adults each day struggle with stress. Another reason is addiction. Once a patient has felt relief of chronic or sharp pain, it can be a spiraling path. Social life of college students surrounded by the party lifestyle may attempt to abuse drugs alongside peers. This is especially dangerous considering there is non-regulatory drugs that they are consuming. This is very dangerous, and I would not recommend ever taking drugs that you have obtained from a party or from your peers. My personal experience and why I think we should try and stop it. There needs to be more awareness for this. I work at a pharmacy. We use these to count pills, and I have filled over hundreds of prescriptions for opioids. Patients will try to get C2s earlier than doctors prescribed. I have witnessed firsthand the drug reliance and how it affects people's physical, mental, and social state. I have also seen some of them pay up to $200 for their prescription drugs. Some of my peers have gotten Adderall unprescribed for dead week and finals week to study. The pressure to perform well on exams is crushing to the point of relying on potentially harmful substances for them. I have also seen the effects of drugs on patients when I shadowed and worked at a hospital. Patients would make up stories of injuries to try to get more painkillers, all for one bottle of drugs. That, or they would intentionally harm themselves for doctors to write a prescription for them. The war on drugs has continued for decades now, but young adults and middle-aged Americans are still at risk. Any person can become hooked on opioids or stimulants. I have seen this firsthand. Not not just the stereotypical image of an addict can be addicted to drugs or opioids. The misuse of drugs has affected Americans to the point of hundreds of thousands of fatalities, and it will only worsen without the proper awareness and prevention. Thank you.